Hi everyone, today I'll be reflecting on how I achieved a high score in my healthcare data for decision making assessment. Assessment 3, I scored 30 out of 30. This was highly analytical task that required applying statistical technique to real world healthcare data sets. The aim was to interpret population health patterns and survival data to support evidence based decision making. I believe my high performance came from the three main factors: a strong understanding of statistical concept, clear and accurate data interpretation, and my ability to present the results in logical professional format. I'll explain these strengths and reflect on what I learned through the process. This assessment required me to demonstrate not just mathematical accuracy but also the ability to interpret the data means for health policy and patient outcomes. In question 1, I worked with life table data to calculate measures like death rate, life expectancy, mortality probabilities for different age groups. The task tested my understanding of epidemiological statistics, particularly how population health data is summarized and used to estimate life expectancy at birth and different stage ages. In question 2, I use survival data for patients receiving and not receiving chemotherapy to calculate Kaplan-Meier survival probabilities and conduct log rank test. This tested my knowledge and biostatistical method used in clinical research and public health. Understanding the overall purpose that these techniques inform real health decisions help me stay focused on the meaning behind the numbers, not just the calculations. Accuracy and attention to detail. A major reason I scored highly was my precision in calculation. In the life table section, I correctly derived measures like death rate, NMX, probability day of death, NQX, number of surviving LX, IX, person years lived LX, and life expectancy EX. I ensured that each value is derived using proper formula, and I checked each step carefully to avoid arithmetic errors. For instance, I showed how I calculated the person's age. 5 could be lived up to approximately 64 or more years on average using the formula EX is equal to EX over IX. This precision demonstration not only technical skill but also academic integrity by clearly showing my working process. Markers value transparency in the data analysis because it showed genuine understanding of the methodology rather than mechanical copying of results. Application of statistical reasoning. Another strength of my work was my ability to apply statistical reasoning to interpret patterns. In the life table analysis, I did not just calculate numbers, I recognized trends across age intervals such as steady increase in the death rate and corresponding disease in my life expectancy with age. In the survival analysis, I correctly identified that patients with chemotherapy had a higher survival probability than those with treatment. For example, by year 5, survival probability among chemotherapy patients was around 0.66, while for those without chemotherapy, it was much lower than 0.38. And I then connected with these figures to real world implications, explaining that chemotherapy contribution positively for survival outcomes in cancer patients, a critical analysis insight. Correct use of statistical test, one of the most important part of my assessment. Um, I correctly stated that hypothesis, null hypothesis, there's no difference of survival probability between the two groups. Alternate hypothesis. I'll just show quickly. Um, yes, this one. and alternate hypothesis. There's a difference between survival probability between the two groups. Then I carefully followed each calculation step, determining the expected number of deaths, applying to the formula of chi-square statistic, and comparing the results with the critical chi-square value at alpha is equal to 0.05. My final test statistic x2 is equal to 0.1633 was much less than the critical value of 3.841. So I correctly concluded that the difference in survival probabilities was not the statistical significant. This showed that while chemotherapy appearing beneficial descriptively, the data samples was too small to confirm the effect statistically. Demonstrating this understanding of statistical significance helped me to meet the interpretation of reasoning marking criteria. Then we'll come to interpretation of Excel for the data analysis. The key part of my success was using Excel effectively. That is I use formulas to automate calculations, reducing manual error. I formatted tables neatly and labeled each column such as deaths, population, survival probability, and number at risk. So that the data was easy to interpret visually. In question 2, I used Excel to generate values for each year survival probability and plotted them into line chart to visualize, compare survival trend between chemotherapy and non-chemotherapy groups. By using Excel as both analytical and visual tool, I met the unit learning outcome related to using software for health data management and decision making. It also demonstrated digital competency, a critical graduate skill. Then comes to logical presentation and clarity. Presentation played a major role in my high score. I structured my answers clearly, numbering each questions and part. Each step of my calculation was shown in sequence from formula to substitution to final answer. This approach made it easier for the marker to follow my logic and check my understanding. I also ensured that the tables were clean, consistent, and properly aligned. Data analysis can lose marks if results are confusing or poorly formatted. So I paid close attention to clarity and presentation. I used brief explanations after each section to interpret the finding, which showed that I could move from data computation to evidence based reasoning, an important skill in health analysis, interpretation, and critical insight. By technical correctness, I think truly elevate my grade was how I interpreted the results. For instance, I discussed how life expectancy declines with age due to accumulated mortality risk, a basic yet essential epidemiological insight. In the in the chemotherapy survival analysis, I didn't stop at the statistical input. I connected the results to clinical decision making, explaining that while chemotherapy increased survival probability, the long rank test showed a difference was not statistically significant. This balance evidence-based interpretation demonstrated maturity in my reasoning. It showed that I could appreciate both statistical outcome and the broader health content, which is what graduate analysis is all about. Reflecting and learning outcomes. Completing this assessment strengthened my confidence in applying quantitative method in the healthcare research. I learned how data-driven decisions are made in real health setting. For example, how survival analysis helps determine treatment effectiveness, and how life tables informs resource allocation and health planning. I also improve my technical skill in Excel and the ability to explain numbers in words, translating statistics into plain, meaningful insight. This assessment deepened my appreciation for data literacy in public health. Understanding the statistic is not just numbers but vital tools influence patient care, prevention strategies, and health policy. So, in conclusion, I believe that I achieved high score because I demonstrated accuracy, interpretation, and clarity across all aspects of the assessment. I showed how I could calculate correctly, analyze patterns meaningfully, and communicate finding professionally. My work met the academic expectation for a postgraduate level by integration, technical precision, public health relevance, and thoughtful reflection. Most importantly, this task helped me to connect theory in practice, understanding how data transform into knowledge and how knowledge driven drives better decision in healthcare. This experience has strengthened my analytical skills, reinforced my passion for evidence based practice, which will continue to guide my future career in public health. Thank you.